Alternative and integrative approaches for the treatment of pain in the elderly. Introduction. The question is always, can we live without drugs? Quality of life means the absence of pain. Often the pain is difficult and subjective to evaluate. In this paper, we try a non-invasive treatment solution that does not raise issues of medical ethics. The purpose of the research. Comparative study of the use of synthetic analgesic drugs, anti-inflammatory and alternative non-pharmacological methods in the treatment of chronic muscle and joint pain in people over 70 years. Non-pharmacological pain therapy prevents the perception of pain by incising the gait. Materials and method. Clinical tests were performed on a number of 350 patients over 70 years old who underwent treatment in specialized clinics Calimonești Cozia between May 2020 and November 2020. In 2020, the coronavirus pandemic put a barrier to spas as well. There was a dominant feeling of war medicine. We had to fight against pain and against an invisible and even more insidious enemy. Pain assessment was done through dialogue. The patient presented a history of pain, and we also assessed the pain response to treatment with analgesics and non-steroidal anti-inflammatory drugs used at home. We stopped the painkiller and anti-inflammatory medication and used only non-pharmacological methods for pain. All patients also had comorbidities: diabetes 80 cases, HTA 75 cases, chronic digestive disorders that have been exacerbated by the use of synthetic analgesic and anti-inflammatory drugs 195 cases. Only medication for diabetes and hypertension was retained. Physiological indicators were also evaluated: heart rate changes, pulse oximeter, blood pressure, temperature, respiratory rhythm, both at the beginning of treatment, during treatment, and at the end of treatment. 20% of patients had their own sphygmomanometer and glucometer. Treatment. Treatment focused on pain and monitored pain on a scale from 0 to 10. Many patients may have been considered hypochondriac because the test results were good, those with fibromyalgia. Sulfur baths were applied daily at 36 to 37 degrees Celsius, 20 minutes per session in the bathtub or pool, depending on comorbidities. Physical analgesic therapy consisted of warm paraffin wraps, galvanic current, galvanic baths or ionogalvanizations with calcium solutions, transcutaneous electrical stimulation, high-frequency currents, short waves on large joints for deep thermal action. The development of technologies for pain treatment has increased the diversity and quality of medical care. There is also innovative equipment in pain therapy, and there are serious advances in the area of miniaturization of these devices. The Cephali device for transcutaneous neurostimulation was used successfully in 32 cases of tension or migraine headaches or trigeminal neuralgia. Massage and active methods of physical therapy to tone muscles and improve joint mobility were applied to all patients, taking into account exercise tolerances. In patients with associated diseases, we have combined diuresis crenotherapy in digestive doses or homeopathic depending on laboratory examinations and paraclinical examinations. The recommended medication for cardiology and diabetes was kept for patients with diabetes and heart disease. Results. Total objectivity does not exist. We have endeavored to keep the inherent subjectivity at its lowest threshold. In a spa resort, you do not have the research possibilities offered by a university center. However, in the period 2020 to 2021, and even now, we have been more involved in treating pain than in recovery. 285 patients reported significant relief of pain and increased joint mobility. In 65 patients, mild pain persisted, and they were recommended diclofenac 150 mg, 1 capsule per day, and diclofenac foam in the evening for a maximum of 7 days. To see if the treatment was effective in the short or long term, we had feedback from the family doctor of each patient. Discussions and conclusions. Two things scare us right now: pain and infection. The long-term maintenance of all epidemiological safety measures is logical. The working time allocated to a patient is considerably prolonged, the timing of some treatments has been maintained, and their order of priority has been rethought. In external cure in the form of baths, sulfurous waters with a concentration over 200 milligrams per liter proved to be very effective. The therapeutic effect of sulfur-containing mineral waters is the result of at least three factors that add up to their pharmacodynamic action: bath water temperature, the movement of the body or its segments under particular hydrostatic conditions, and the chemical composition of water. Sulfur baths work by providing the essential sulfur in glucosamine and collagen in the joints. International research on sulfurous waters, as well as research in palaidotherapy, have also shown increased immunity, immunomodulation, and collagen protection. How does the spa contribute to improving the health and life of patients? We want to offer customized treatment solutions, and we want these therapies to be available to as many eligible patients as possible as soon as possible. Due to the pandemic, a lower amount of patients came for treatment. They stayed home with painkillers, NSAIDs, and food supplements. We took the data from the family doctor. The number of patients who took a prescription for NSAIDs and painkillers doubled. Of the total number of patients, many did not have a prescription and administered their own medication, self-medication. I'm never in a hurry with the conclusions, but looking to 2022 with optimism, we strongly believe that through collaboration and solidarity, we can significantly improve patient care standards. Retired physicians are committed to remain a reliable partner for identifying solutions that could bring significant benefits to the health system and patients. Nowadays, when medicine is simply suffocated by synthetic drugs, dietary supplements, etc., the methods of natural medicine are experiencing a new renaissance. These non-pharmacological therapeutic means for pain control are not without risks and certain harmful effects. The presence of a specialist is mandatory, especially in patients with associated conditions. The unscientific or abusive use of alternative methods for pain therapy is very dangerous. Thank you for your attention.